Welcome to this video about the Care Act duties on assessment of needs. Please note that we have other videos about this topic on the Sky website, along with other resources and a handout with key messages and reflective questions to support you to embed the learning from this video into your practice. My name is Paula and I'll be taking the role as social care practitioner, and with me today is June. Hello, June.
Hello, Paula.
Hello. So in previous videos, we've explored what the assessment of needs duty is under the Care Act and the things that a social care practitioner should take into account so that we can enable the individual to take a lead in that process wherever possible, because the process is about their life. So the Care Act informs the social care practitioner of three fundamental elements of the assessment process. The first of which is to understand the outcomes that an individual wishes to achieve in day-to-day life. And this is in relation to their day-to-day life, okay? So the conversations need to be exploring things that are important to that person, such as being able to meet my friends on a regular basis, to be able to contribute to my local drama society, whatever it is that is important to that individual. It is not about the eligibility outcomes, okay? So as a social care practitioner, questions that will support the individual to think about the things that are important to them so that I can support that individual to lead the discussion. I shouldn't be asking leading questions around eligibility outcomes, for example, tell me how you manage and maintain your nutrition on a daily basis, because this part of the assessment process is finding out what is important to the individual. So as a social care practitioner, I need to support the individual to lead the conversation, and asking strengths-based, open-ended questions is a way in which I will be able to do that. So June, when you think about your life, okay, what needs to be in your day-to-day activity so that you can feel that you're having a good day?
Okay, well, first of all, I'd like to start with saying that for me, needs are best expressed as requirements. And that is because needs seem to put me into quite a subjective position of having, needing to call on whoever, whatever, for support. Now, I actually think that if I reframe it or rephrase it into requirements, it takes the needy bit out of me, and it's actually others and society and generally in what we're going to talk about, my life, that help me to meet those requirements. That seems better to me. So
fantastic. Okay.
Going on to answer your question now, what do I need to in fact, can you rephrase the question again, Paula?
Yeah, so what is it that you think's important in your life so that you feel that, when you go to bed at night, that you've had a good day?
Okay, well, for me, what's important is that I actually feel that I have kept my self-esteem, so that actually, if all those around me are understanding that and respecting that, including any practitioners who come to see me, that keeps my identity strong and my integrity strong. I always need to believe very strongly in myself, because I've had years of where I didn't. And it's only by reflecting on that I've been able to turn it round. So now I probably do not, I challenge anybody who tries to take that self-respect away. And so if people talk to me in terms of, well, you can't do this, what we call deficit, then I would challenge that. So, yes. Okay, so just really, yes, to say, continue with that if a assessment or any conversation with me is about what I can't do. That really does ruin that hour, that day, the after. So it has to be about really coming at the angle of what I can do, and that keeps my self-esteem, my confidence, my well-being up. And I do have some things that I call on. I mean, just to say that I am a spiritual person, so it's important to keep my contact with what I say, a higher being, and I actually start my day in that way. So I meditate and do things like that. So that starts my day. Then all the interactions I have with other people, I'm expecting to respect who I am and what I've done in my life and where I am now. So they just, and if they don't, then I would respectfully challenge them and tell them, you know. So that's really how I get through my days and weeks and months and years. Yes.
Yeah, fantastic. So important for you then is your opportunity to engage with your spiritual side. So that space to be able to meditate, for you to have interaction with other people is important for you on a day-to-day basis. And so there are the, you know, if you've got those sorts of things in your day, you'll go to bed feeling like you've had a good day. Is that, have I understood that right? So the individual circumstances will direct the breadth and the depth of the conversation that we will have as part of the assessment process. But more often than not, from my experience, when you ask questions like, what does a good day look like to you? The first responses that the individual brings up are likely to identify the things that are important to them. And so I will keep a mental note of that, or I'll make a record it on a piece of paper in the individual's own words, so that when we get to the point where we need to put some sort of structure to the outcomes that they would like to achieve, I've got that information ready for me. So it's necessary for the social care practitioner to capture a full picture of the individual's needs or requirements, as June would refer to them in this situation. And so this can be difficult to do without understanding what it is that an individual is trying to achieve. But it doesn't mean that we need to know everything about the individual from the point that they were born up until the day that we are sat having that conversation with them. It's important to know the things that are relevant in terms of the outcomes that they're wanting to achieve and the presenting needs or requirements that might be visible in that individual's life. So June, I know that you've been part of an assessment process before, okay? And I appreciate that it wasn't under the Care Act, but at any point during that assessment conversation or assessment process, were you asked what it is that you wanted to achieve or what was important to you on a day-to-day basis?
Yes, I have been assessed a few times, but the one that's significant and really stands out in my memory has it influenced me on the path I'm taking, is that I was actually not listened to. I was asked if I would go into hospital voluntarily, and I said the words, "I don't know," and that was construed as a refusal. And from that time afterwards, I would say I was taken over, you know. So other people were making decisions for me and not really including me. So I had 3 professional people come to do this assessment, and they said, well, if we're going to arrange for you to come in and in a compulsory manner. And fortunately at the time, I didn't have, the process wasn't ready to continue. And that was because in this instance, I needed to have what they call a nearest relative with me, and he was not there. So I sent for him. Another professional came back later in the social care profession when my when my relative was home. And in the proceedings, he saw that I was ready to go into hospital, not under a compulsion or duty, but voluntarily. So that's what I did. And he listened to me to say, well, you look like you're ready to go in. And I said, I am. And I was eating, drinking, packed, all those sorts of things. And so he actually arranged for me to go in. He'd actually called for an ambulance, expecting to see me quite distressed. And maybe, I don't know whether he thought I would be resisting, or I certainly wasn't in a place to physically resist because I wasn't strong enough. And so, to cough again. So I went involuntarily into the hospital. And he then had a verbal fight with the professional in the hospital saying, why didn't you bring her in under a compulsory duty? And he said, because she didn't need to. And so she's here. I stayed there for a fortnight. And why I say it's significant, that fortnight, basically, they were able to pursue that duty of compulsory admission. And, yeah, and it just didn't, the duty showed me, the paperwork showed me as still being in the original conditions, and I wasn't.
Okay.
And so, yeah, basically, so when that person came back, the social worker, that was the first social worker, came back and he posed the duty, the compulsion, and he didn't listen. And he didn't listen or look at any observations about what I was like then. So I think that was my most, well, it was my most onerous, but my worst experience of somebody not listening to me, certainly not asking what my wishes were and taking those into account.
Okay, and you use the word taken over, so that's not a very positive experience, is it? It's to, no. that doesn't reflect a very positive experience. And so even if I appreciate that you were being assessed under the Mental Health Act at that time, but still that consultation with that co-designing, that co-production with the individual is important, because that, even the Mental Health Act framework, is there to support people to go on that journey towards wellness. And so at that point where you said, will you go into hospital, that was the only opportunity that was presented to you. Yeah, is that right? Yeah,
absolutely.
Yeah.
Yes.
Okay. So it's important that when we're doing an assessment of need under the Care Act, that we're not doing it to an individual, to June, okay, but we're doing it with them. We're trying to find out those things that are important to a person, and those things that, the difficulties that they're facing at the moment, so that we can understand what their needs are or what their requirements are that might benefit from social care, from care and support. Yeah, so if we don't have as a starting point an understanding of what is important for an individual, okay, we're not going to know how, what the direction of the assessment process will take. We're not going to know how much other information might be required to support the individual to understand their needs or their requirements, and we won't be able to determine together, again with the individual and the social care practitioner, what an appropriate and proportionate response to this assessment process will be. And so as a social care practitioner, it is really important for me to know about the individual, so that I can be thinking about the types of questions that I might ask later in the conversation, the types of information that I could provide or look for at a later date, and it will help me to understand and provide the personalised advice that might be necessary for the individual that I'm working with. So through the process of asking questions that will enable and give the individual individual or any other person that's involved in the assessment process the time to think about what's important to them on a daily basis will support me and the individual to be actively, to be a joint to jointly be in that conversation, that we're there in that together, we're supporting each other, and we're ultimately wanting to see what we can do to support the individual moving forward. So it's important as a social care practitioner to reflect back what I've heard the individual say to me so that I can make sure I've got the correct understanding of what's important to their day-to-day life. So using the words that the individual uses is a really good way of checking in, because they've chosen them words for themselves and those words are important for them. And so it is good to kind of reflect back using that individual's words. And it's also important to just remind social care practitioners that when we're creating the assessment form, so recording the assessment process on our internal systems, that we do, wherever possible, use the words of the individual during the assessment conversation and process. It might be necessary for me to support the individual to put their thoughts and feelings into phrases that give a clear structure to their personal and desired outcomes. And this can be an enlightening moment for some individuals as well, because it's given them an opportunity to think about things differently or to get a better understanding of how things are in their life and what they would like their life to look like. And for me, one of the most beautiful statements within the Care Act guidance is that the care assessment is a therapeutic intervention in its own right, and it's for reasons such as that align with me and speak to me in terms of how it is a therapeutic intervention. The conversation around outcomes, and as that develops into a conversation around what the needs or requirements are to enable an individual to achieve those outcomes, just help to develop and understand and verbalise what's important to a person. And this will also help us to understand, both of us, to understand what is important to that person's individual well-being when we think about the third component of the Care Act assessment of needs. So I mentioned at the start of this video that there are three very important elements to an assessment of needs, and the second two, which are the needs or requirements that are preventing the individual from achieving their personal and desired outcomes, and how this impacts on their well-being. And these will be explored in another video in this series. Thank you for taking the time to sit with June and I today, and please don't forget to check on our other videos on the Sky website in relation to this topic and also others under the Care Act. Thank you, June.
Thank you, Paula.